name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with fertility and pregnancy, starting with the letter B. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions, then I'll move on to ailments of the brain and nervous system. Then I'll address issues with your skin, nails, hair, ears, eyes, nose, teeth, gums, lungs, respiration, heart, blood, circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestine, liver, gallbladder, pancreas, kidney, bladder, then ailments specific to women and specific to men, then issues of the hormones and the metabolism, then homeopathic remedies for infections, infestations, and the immune system, then issues surrounding fertility, pregnancy, childbirth, postnatal problems, then homeopathic remedies that address special problems in infants, ailments and diseases in childhood, and special issues of adolescence, and finally, special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it is recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or arsenicum album types, those who react strongly to arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, nature-mere people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, lycopodium types tend to be tall, ganglion, of a stooped appearance, with an anxious expression and a craving for sweets, and a propensity to produce intestinal gas. Of course, constitutional types have their limitations. In reality, each person is an individual. And so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what is meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So, let us continue with learning how homeopathic treatments can help with fertility and pregnancy, starting with the letter B. Every month during a woman's reproductive years, a ripe egg is released from her ovary and enters the fallopian tube, and the mucus at the entrance of the womb at this time becomes less sticky. If intercourse takes place, millions of vigorously swimming sperm make their way through the mucus and into the womb, and into the fallopian tubes, where they congregate around the egg, causing it to spin around with the movement of their beating tails. Eventually, one sperm penetrates the egg, and the nuclei of sperm and egg fuse, and the process of cell division begins. The fused nuclei split into 2 cells, then 4, then 8, then 16, all containing the 46 chromosomes that will create a new and totally unique human being. 7 days after fertilization, this ball of cells embeds itself in the wall of the uterus. At 20 days, the placenta begins to form. At 30 days, the spinal cord. At 6 weeks, the heart. And by 13 weeks, all the body organs are formed. By 5 months, the baby can be felt to move. At 6 months, the lungs become functional and the nostrils open. At 7 months, the baby should be in the head-down position, ready for birth. A full-term pregnancy usually lasts 38 weeks, counting from the moment of conception to the time the baby is born. Conception usually takes place halfway between periods if the woman's cycle is 28 days and regular. However, since many women's periods are not exactly 28 days, pregnancy is usually measured as being 40 weeks from the first day of the last period. Common pointers to pregnancy are missing a period, more than usually tender or swollen breasts, and darker nipples, nausea, tiredness, a frequent urge to pass urine, and sometimes loss of appetite or cravings for unusual foods. To confirm the pregnancy, the woman should have a pregnancy test. The chances of having twins are about 1 in 80. Identical twins develop from the same egg and share the same placenta. Non-identical twins develop from 2 different eggs and have a placenta each. Only 3 pairs of twins in every 10 are identical. Triplets are much rarer, only occurring in 1 in 6,400 pregnancies. Once it is determined that the woman is pregnant, it is important for her to go for regular prenatal checkups. Prenatal care is important since it allows you to find out at an early stage if there are any problems. An ultrasound, which is a sound picture of the baby in the womb, is thought to be harmless to mother and baby and can be used to monitor the size, shape, and position of the baby at any stage of pregnancy. Amniocentesis, which is the taking of a sample of the amniotic fluid around the baby, is usually carried out between 16 and 18 weeks, but only if a previous baby has been abnormal, or if there is a family history of congenital problems, or if the mother is over 35. Here in brief are some of the do's and don'ts of pregnancy. Treat your baby as a person from the word go. Moderate exercise such as swimming or walking in the fresh air are very good, but anything that involves repeated compression of the spine, such as horseback riding or trampolining, should be avoided. Always keep 25% of your energy in reserve. Do go to prenatal classes. They will teach you what to expect and how to breathe in order to cope with pain during labor. Don't wear tight clothes and get as much sleep as you can, and avoid late nights. Also, don't sit in hot baths for too long. 10 minutes is about the maximum, especially if you faint easily or have a tendency to bleed. Avoid serious traveling if you can, especially if you have had a threatened miscarriage, or there are complications, or you suffer from travel sickness. Most airlines do not like you to fly after 32 weeks or so. So if you must fly, check with the airline first and stop working before 28 weeks if your work is very strenuous. The expectant mother needs to eat a healthy, well-balanced diet with an increase in iron and calcium foods, and also a modest increase in protein intake, preferably in the form of oily fish, nuts, seeds, pulses, and whole grains. With generous helpings of raw vegetables and fruit, will help to guard against constipation. Tea, coffee, and alcohol should be avoided, as well as chamomile tea, especially in the later stages of pregnancy. Homeopathic remedies during pregnancy. During the first 3 months of pregnancy, the most vulnerable time, you should avoid all medications if possible. That means prescription drugs, recreational drugs, over-the-counter preparations from drugstores, and health food shops. There is no evidence that homeopathic remedies cause any problems during pregnancy, but to be on the safe side, they should not be taken in potencies less than C6C, except for tissue salts. It is probably best to avoid low-potency APIS altogether and take 30C if you need to. For minor complaints during pregnancy, homeopathic remedies should be tried first. If you feel unwell, see your doctor before taking anything. Backache during pregnancy. Lower back pain is common in pregnancy as extra weight accumulates forward of the spine and as the ligaments of the pelvis begin to stretch in preparation for birth. Extra care should be taken when bending, lifting, or twisting. When standing and walking, the baby's weight should be allowed to pull the pelvis too far forward. When lying on the side, a pillow buttress for the abdomen takes some of the strain off the lower back. Specific remedies to be taken 4 times daily for up to 7 days. Your back feels weak and tired, dragging pains in the middle and lower back. Use Carb 6C. Hard, tense feeling in the lower abdomen. Head feels hot. Use Belladonna 6C. Hard, tense feeling in the lower abdomen. Feeling hot all over. Symptoms worse in stuffy rooms. Use Pulsatilla 6C. Hard, tense feeling in the lower abdomen. Feeling chilly. Use Nux 6C. Specific remedies to be taken every 2 hours for up to 10 doses. Backache due to injury or strain, use Arnica 30C, followed by Rhus Tox 6C every 6 to 8 hours for up to 7 days if the backache persists. Self-help. If you are prone to backache, even when you are not pregnant, take the tissue salt Calc Fluor and Calc Phos 3 times daily for 5 days out of 7 during pregnancy. Breast discomfort during pregnancy. Distension of the breasts during the first few months of pregnancy is quite normal and due to hormone changes. In the last 2 or 3 months, feelings of fullness and discomfort are due to incoming milk. However, if discomfort is accompanied by fever and tender glands under the armpits, mastitis should be suspected, in which case see a doctor within 12 hours. Specific remedies to be taken every 4 hours for up to 5 days. Mild discomfort caused by enlargement. Use Conium 6C. Breasts feel hard and tense. Use Bryonia 6C. Breasts feel hard and tense with red streaking of skin. Use Belladonna 6C. Breech and other malpresentations. Before 36 weeks, it is sometimes possible to turn a baby in the womb, that is, turn the head down and the buttocks up, or turn the body so that the baby is facing the mother's buttocks. By giving 3 doses of Pulsatilla 30C at 12-hour intervals. If this fails, it may be possible to manipulate the baby into the normal position. If the malpresentation persists, the baby may have to be delivered by forceps or C-section. I have a great many videos now on many different topics, so I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.